What's up, everybody? Welcome to another episode of Fitness Facts. I'm Dr. Jordan Taylor, the Undergraduate Exercise Science Program Director and Associate Teaching Professor at the University of Kansas. On today's episode, I'm excited to have Dr. Trent Herda in the studio to discuss all things related to stretching and flexibility. We will review some of his research in this area and also answer the question, should you perform static stretching prior to high-intensity exercise or athletic events? Dr. Herda is a professor here at the University of Kansas and is currently the director of the Neuromechanics Laboratory and the Hawk Fitness Academy. Dr. Herda completed his doctoral work in exercise physiology at the University of Oklahoma. He has also earned a Master of Science degree in exercise physiology from the University of Oklahoma and a Bachelor of Science degree in exercise science from the University of Sioux Falls. Dr. Herda is a member of the American College of Sports Medicine and National Strength and Conditioning Association. He specializes in researching neuromuscular mechanics and physiology across the lifespan. He has published over 100 peer-reviewed scientific articles in journals such as Acta Physiologica, Journal of Neurophysiology, Clinical Neurophysiology, Experimental Physiology, Medicine and Science in Sports and Exercise, and the European Journal of Applied Physiology. Mouthful. Welcome to the show, Dr. Herda.
Glad to be here. Let's have some fun.
All right. So several stretching techniques can be used to increase or maintain flexibility. And the most common of these include static stretching, dynamic stretching, ballistic stretching, which you typically want to avoid, right? And proprioceptive neuromuscular facilitation, also known as PNF stretching. That's a mouthful.
We'll go with PNF.
Right. PNF is a lot easier, right? Can you briefly define and describe each type of stretching? So maybe we just start with...
How long do we have?
All the time in the world. So maybe we just start with static.
Static stretching is typically what we think of when we go touch our toes. And believe it or not, one of the papers we'll talk about, there's actually subtle differences in static stretching that actually really affects muscle tendon stiffness. Before I run through the rest of these, there's also just a lot of overlap between all these stretching, where we typically in practice do a combination of all of these.
Right. And that's what most people are familiar with, right? You do a static stretch. You all did this in PE, if you can think back to when you were in elementary school. And it's like, okay, bend over, you touch your toes, you stretch your hamstring, and you hold that for 15 to 30 seconds. And then typically you repeat that, 2-3 times. And that's your static stretch, right? You hold it to a point of mild discomfort, no pain. That's static stretching. Right?
And it becomes a little different if you have assisted static stretch, where there's a little constant pressure on it. So there really are a couple forms of static stretching.
Right.
And I would say the same thing with dynamic stretching, which I think at times can be confused with maybe just a dynamic warm-up, or maybe they are the same thing to you.
Well, and people confuse stretching in general with a warm-up. It's two different things, right? I mean, so typically you want to warm up, right? And that could be, going for a jog, doing some dynamic movements, lunges, butt kicks, things like that. Karaoke, you see this all before, maybe players warming up on a football field. But then you increase that intramuscular temperature, that core temperature, get a light sweat going. Maybe you do that warm up for 10 minutes, 5 to 15 minutes. Then we can get into whether you should stretch or not, or when you should stretch. But you always need to warm the muscle up, right? But that's different than stretching.
Yeah. And so dynamic typically means in the stretching world, you're going through that range of motion that you would use during the exercise or competition.
Right.
So you're moving the limb through that range of motion and not really maybe pushing the limit per se what the range of motion is. Ballistic is done less often than most of the other stretching. It's more bouncing. So maybe you are touching your toes and now maybe a better example is you have a foot on the desk and you're kind of bouncing. You're at the end range of motion. You kind of start oscillating. It's typically what they call ballistic stretching. And then PNF is, I think, sometimes also used in the static stretching realm, where now you're putting the foot to the end range of motion and they're contracting that muscle,
right,
to push against that stretch.
Right. And there's a whole, with ballistic, that typically that you want to avoid that because you can activate what's called the stretch reflex. I talk about this in my classes, but if you rapidly stretch a muscle, there's little proprioceptors within the muscle that are called muscle spindles, and they detect the rate and the amount of length change. So if you rapidly stretch it, it fires up those muscle spindles, and then a neural impulse is sent into the spinal cord, and that can cause like a reflex activation of motor neurons that send a message back to that same muscle and tell it to contract. So you could be more likely to get injured if you're doing this, bouncing ballistic type stretching. So typically that's one type of stretching you would want to avoid. I'm sure you probably agree with that.
Yeah, and we're going to get to the question whether you want to do this before sport performance, a high-intensity exercise sport performance. And the argument against static stretching, and our research has shown, is the muscle spindles are also influenced by the constant stretch and will stop being activated. Is one of the reasons why we see that strength loss, which we're going to talk about here in a second.
Okay, great.
Yeah, so the spindles are a player basically in all the stretching.
Yeah,
because fibers are lengthening and shortening, so they could become more responsive or less responsive.
And you know what I'm seeing? Like if you go, I can think back when I used to go out to like Arrowhead Stadium in Kansas City and watch a Chiefs game in the 80s or 90s. I'm dating myself now. Or you go watch a KU football game. Back, in the 80s and 90s, you would see a lot of static stretching of the players on the field before a game. Now you go, it's all dynamic movements. It's all dynamic stretching. Your maybe marches with high kicks, your hockey lunge walks, everything is dynamic. Even like arm circles, arm swings. Those are examples of dynamic stretching.
Yeah,
and that's what you see.
And yes, correct. And you can, another video is you see a lot of times now they'll do a little warm up before the stretching. And the warm up is they do like agility ladders. Mm-hmm. They'll get moving in with agility and little plyometrics, and then you kind of see them do the dynamic stretching. Right. So again, something we'll probably talk about later. A little warm up before the stretch is not a bad thing either.
Yeah. Well, all right, I think we covered that. So we move on to question 2 then. What factors affect flexibility? What can make a person more flexible, less flexible? And when we talk about flexibility, right, it's measured as a joint range of motion, right? So if you're more flexible, you have a greater joint range of motion. You're less flexible, you have less joint range of motion. And flexibility can be specific to the various joints of the body, right? So you can be very flexible in one area, say the shoulders, but very inflexible through, say, the hips, right? So what are some factors that affect flexibility?
The number one factor that affects flexibility and range of motion that no one really talks about up front is just pure pain tolerance. So you get to that end range of motion, it hurts. You keep doing that, it hurts a little less. And you start pushing your flexibility, increasing flexibility. That really is one of the main drivers in flexibility and range of motion. Certainly not discounting if you're maybe not aging in a healthy manner, maybe you have a little bit, you're kind of inactive, you're starting to lose some of those large fibers, it's turning into connective tissue, and range of motion is also going to shrink.
You get some fibrosis as you age, potentially, that hinders your flexibility.
Yeah. And certainly there's always typically sex-related differences, which can be hormone-related, differences in hormones. Or I like, females tend to be a little bit more flexible than males in most of the literature, not all the literature. It could be a pain tolerance thing too. Mm-hmm. It's the joke we always have in our lab.
These guys are just, I guess, wimps.
We are wimps. And one on your notes here, on the notes, we also discount activity levels, and I see that as, what activities are you doing? If you're sitting all day, and this is what you do, you are becoming less flexible.
Right.
If you are going and...
You mold to your chair.
Yes, exactly. So you mold to your physical activity, which is going to influence your range of motion. So if you are someone who's active in the yard, bending over a lot, getting stuff off the ground, you're likely going to have better flexibility and more range of motion.
Right. You compare somebody that maybe works construction versus somebody that has a desk job. Yeah. Well, look at the difference in activity levels and potentially differences in range of motion and flexibility there.
The other... biggie that you hear about a lot is too much muscle, bulky. There's a lot of elite athletes that are very muscular but extremely flexible. I think of wrestlers. Like elite wrestlers usually have a lot of muscle for their frame,
right,
and are extremely flexible because their sport demands it. So it's not in the laboratory.
Gymnasts.
Yes. Another great example. In the laboratory, quote unquote muscle size doesn't seem to associate that strongly with flexibility and range of motion, but it does with muscle stiffness, which is something we're going to get to here in a second.
And I guess in some cases I know I can think back to when I was playing football in junior college, and we do power cleans, and sometimes with my arms, like the bicep, just getting into that rack position, some of that's lat flexibility too, and tricep flexibility, but sometimes I felt like a little impairment there, and of course fat mass also in individuals that are, maybe severely, they're obese or overweight, that could also impair joint range of motion too. But
and then, the one that we're skipping over, but it would be pretty obvious if you have damage to a joint,
right?
And that's kind of where a little bit maybe the fat mass plays in. Yeah. It's going to definitely affect the range of motion.
And I know, speaking of joints, like with joint structure, and I've done a video on this where I talked about, position of the feet, like say during a barbell back squat. It's like, well, depending on if you have more anteverted, forward-facing hip sockets, or more retroverted where they're kind of rotated backward. You can't change that. That's your structural bony anatomy. But you may feel more comfortable with a wider or narrower stance. If they're anteverted, typically narrower. If they're retroverted, a wider stance. And that's just your joint structure. You're not going to be able to change that. It's not like you have a functional deficit, like you're not moving properly. It's just you may feel more comfortable at a certain hip position versus another because of the way your pelvic girdle has formed.
Yeah.
So,
the other one that's not on the notes was, well, I guess it kind of is age, but youth are extremely flexible.
Oh yeah.
It's easy. We'll get into another topic later about youth and resistance training, but they're much easier. They have an easier time adapting to the skills like deadlifts, squats, because they are flexible.
Yep.
They're way more flexible than we are.
It's easy to get in that starting position and perform the movement. Yeah. Whereas somebody that's inflexible, it's hard to just sometimes get into position to use correct biomechanics to perform a movement, say in the weight room, or maybe it's an activity of daily living, that they struggle with. All right. So let's move on to what are the benefits and adaptations associated with long-term stretch training?
Well, the big one, increased range of motion. So we just had this little conversation why people might be inflexible or have limited range of motion. You can always improve it. It's definitely something that you should work at as you're older. We're getting molded. Most of us have these jobs where we are in chairs all day. It's probably a good idea to do a little bit of flexibility training, keep trying to maintain or increase the range of motion. The biggie is stretch tolerance. I think there's probably a good amount of literature or experts in this field or study that would say that the biggest adaptation to stretching is just a tolerance to the stretch and just increasing range of motion without maybe a ton of changes happening to the actual skeletal muscle system. Something that is under-researched, but there does seem to be limited evidence that stretch training will actually increase a little bit of lean mass. There may be a little bit of hypertrophy.
Stretch-mediated hypertrophy.
2 decades ago, I probably laughed at that.
I still feel like I laugh at it, but I don't know. I haven't really dug into that research a lot lately.
And to be honest, this is my work from really as a master's student and a graduate student. So this isn't something we've kept up with that closely here at KU. We do it every once in a while if I have a student who's interested. But it does seem more plausible. There are pretty tight controlled experiments that would suggest that does happen. Now,
maybe if someone was applying pressure and a load, almost like eccentric training, right?
Yeah.
If you're doing, like if I sit here and I'm just lowering a load, like a barbell onto my chest, right? Yeah, I'm stretching out the pectoralis major. I'm stretching out, the anterior deltoid fibers.
And it's basically PNF in some ways. Like you can manipulate PNF to be eccentric, like create eccentric muscle damage if you really wanted to.
Right.
So there is a little bit of that. What I think those are the big benefits. Range of motion. Why do we want to increase range of motion? Help daily activities.
Right.
Physical.
Improve an athlete's ability to perform certain movements on the field.
Yes,
right. Or on the court or the track. Right.
Like you said, I go back to wrestling and shot defense. Anyone who watches elite wrestling, they are extremely flexible in defense. Fighting off shots or getting around the corner or anything they would do in a match requires a large range of motions.
Right.
So.
Right. And then what about, does stretching have an effect on like spinal reflex pathways?
Yes. In my research, it doesn't seem to be an effect we want.
Okay.
It acutely. Now, stretch training's, I don't know how much this has actually been done, but acutely, it tends to diminish those reflexes. It tends to diminish those signals from the muscle that are really important to activate your large muscle fibers.
Right. So you have what's called motor units, right? A motor unit is one motor neuron and all the muscle fibers that's attached to it. And so if you can imagine these motor neurons coming out of the spinal cord and then they're branching out and connecting to muscle tissue. When those motor neurons send a signal to the muscle tissue, they're going to recruit fibers to produce force. But stretching may reduce the activity of those motor neurons and those motor units, which again, a motor unit is one motor neuron and all the fibers it connects to. So you basically have less what's called like neural drive to the muscle, right? So it's like the stretching may reduce the message coming from down the spinal cord and then from the spinal cord via those motor neurons out to whatever muscle you just stretched, where you just have that reduced neural drive from the nervous system to that muscle, which then may ultimately lead to reduced force output, which I guess we're going to talk about in a little bit.
Yeah, we'll talk about it a little bit for sure.
And then what about tissue properties? Things like, can you explain like stress relaxation and reductions in muscle tendon stiffness? I mean, those can change during a single stretch session, but do those effects last like with long-term stretch training, or is becoming more flexible more due to just your improved ability to tolerate stretch, maybe reductions in the spinal cord excitability and the motor neurons, or is there actual changes to the musculotendinous unit and that connective, the connective tissue and the muscle long term?
That's a great question.
It's a very
complicated question. First, stress relaxation is if you hold the hamstrings at a certain muscle length, you actually have the resistance being produced by that hamstring. That resistance will go down over time as you hold it there in stress relaxation. And typically in practice, if the muscle starts you start feeling that tension go away, what do we typically do? We reach further and stretch a little longer. So that is an acute phenomenon. I'm not sure I don't know if that's good or bad long term to do that daily. To be honest.
Well, we've got a question coming up about can you be too flexible? So we'll get to that, right?
So I don't know how much that plays into. It's an acute adaptation. Long term, I'm not sure honestly what that means. It's not something that's often looked at, but it's definitely a mechanical property of tissue. The relaxation of that tissue when it's held at a constant length.
It just basically becomes more compliant.
Yes, it becomes more compliant.
The tissue is...
And that would make you think, well, there's probably a lot of times you don't want more compliant tissue. So when this happens, this stress relaxation happens, and we continue to stretch, we push it, our tissue will ultimately become less stiff, more compliant.
Right.
Which acutely reduces the amount of force transmitted to the bone. So we could have two things happening here acutely. You have neural drive decreasing to the muscle, causing it to be weaker. You're not activating these large fibers as much as you should be able to. And because the slack in the system, the compliance, is reducing the amount of force being transmitted to the bone.
Right.
But long-term with training, I don't think that's a big issue. You're not going to be, with flexibility training, I think a little caveat here. I think if you're older and you're very inflexible, you might be decreasing the stiffness of the muscle, which with training, which in that instance might be a good thing.
Right.
Where that overcomes the loss of maybe that transmission in force.
But for somebody young, it's like, do you really need to make them more flexible? They're a child. They're already.
Yeah. Well, yeah, a child. Do you? I think as a college student, greater range of motion, I think, is important, which is flexibility, but that's not necessarily the muscle stiffness conversation. It's almost two different things.
It's two different things. Yeah, it's apples and oranges. Well, and like Coach Joseph Potts, who I've had on before, and he talks about with his athletes at Top Speed Strength and Conditioning in Kansas City, you want to balance there. You want some flexibility and good joint range of motion, but you also want that stiffness. So he said like when you're sprinting and you're striking that ground like a hammer, I mean, you want to transmit that force. Yeah, you want to be able to transmit force into the ground. And if you've got a lot of slack in the system and muscle tendon is that unit is too compliant and it's just there's slack in it, then you don't transfer that force effectively into the ground.
And there's actually a last piece of this that's pretty important that doesn't get discussed that often. Coach Potts talking about, want stiffness in the muscle. Stiffness in the muscle, higher stiffness level, a larger muscle has greater muscle stiffness. You're like, oh, that's bad for flexibility. Not really, because it's kind of two different things.
Right.
It's actually great for absorbing energy.
Right.
So it becomes it's tougher the stiffer the muscle is. So there's an idea just having a stiffer muscle actually reduce the likelihood of injury. Again, something that's very hard to research.
Yeah.
But the math behind it would suggest there's some truth to that.
Right.
So again, separating that stiffness from range of motion, flexibility in range of motion is pretty important.
Yeah, that is. That's a good. I'm glad you made that distinction because a lot of people get confused about that. And so I just have a note here that Duchateau and colleagues in 2004 they showed that if you're wondering, well, how long, maybe you are an older adult and you're wanting to work on your flexibility and joint range of motion. Well, kind of what are some guidelines here for stretching? Well, Duchateau and colleagues in 2004 showed that you can make pretty substantial increases in flexibility and range of motion after 6 weeks when performing 5 stretching sessions per week. And then once you maintain whatever desired level of flexibility, just stretching 2 to 3 times a week, you can maintain that. So it's easier to maintain than actually achieve, whatever level of flexibility you're looking for. If you're looking for just guidelines, so those are kind of it. And like I said, if it's a static stretch, hold it 15 to 30 seconds to a point of mild discomfort. You should improve your ability to tolerate that stretch as the sessions go by. And repeat each stretch for each muscle group 2 to 3 times. I think those are pretty fair guidelines.
Yeah, and flexibility is a component of fitness that is overlooked. We always think of cardiovascular, muscular strength, but flexibility is there. And the lucky thing is it takes a lot less effort to improve flexibility than maybe the other two components of fitness or the other components of fitness. So it is important, often overlooked. You don't see a ton of people stretching in the gym. Yeah. So, it should be included in a fitness program.
I struggle with the body comp component right now, living in Kansas City with all the barbecue. That's the domain of fitness I struggle with. All right, so let's move on to the next one. So, and we've kind of hit on this already. I don't know if there's anything else you want to add, but you talked about how muscle stiffness is important, and that could actually help reduce injury and really help support joints, especially you think from eccentric, like landing or loading, or what about, can a person become too flexible where it actually increases their risk of injury or maybe impairs their athletic performance?
I'll take this a little different direction.
Okay.
Ankle sprain, you have passive properties of those ligaments and, or tendons, whatever's involved in the sprain, they're being less compliant. And then you have an issue for the rest of your life. So that joint, in that instance, that is an in range of motion. That's kind of, I think, where you're going with this question. We hear all the time, shoulder injury, shoulder pops out. There's damage around those ligaments. Those ligaments are less compliant. What's that shoulder going to continue to do? Come out.
Yeah.
So that's one way to take it. As far as is too flexible, it's probably for everyday individuals, probably not in practice, but there is situations where we do get tissue that's not quite as compliant as it used to be, and it does become a problem.
Right.
And then again, impaired athletic performance. I think we kind of hit that with that conversation, but also just understanding that hypertrophy is good for improvements in strength, and it's also good for increases in muscle stiffness and fighting off injuries.
So yeah, I think Coach Potts had it right. It's like, there's a balance between stiffness and flexibility. There has to be this balance.
Yeah, and the balance shifts as we age, basically.
Right, yep. You have to look at it on a spectrum, right? With like extreme flexibility over here, extreme muscle stiffness over here, and then there's this, it's like a lot of things in life. It's
so I think what the take-home message is, someone can be extremely flexible but have high muscle stiffness.
Right, yeah, you could be, yeah. All right, so coaches, athletes, trainers, and fitness enthusiasts often state that stretching prevents soft tissue injuries, for example, muscle strains, right? Does stretching prior to intense exercise or athletic competition actually help to prevent muscle and tendon injuries?
That is such. It is. Everyone always wants to know this. It is so hard to research that question.
Yeah.
I mean, I think there's
the
probably,
literature seems murky to me. Am I correct on this?
Yeah. And is it murky because we don't have funding in this area to really answer that question?
Yeah.
Probably. I think you could see, look at one large scale epidemiology type study and be like, oh, it looks like it probably had some effect on reducing injuries. And you can look at another type of large scale study where, it didn't do anything. And when I say large scale study, those aren't studies in laboratories. They're basically following teams around and seeing what they do for stretches and if it really changes injury risk. So, I don't think we know, in the laboratory, but there's probably a part of me, this is having a greater range of motion is probably a good thing when it comes to reduction of injuries. Right. So, I mean, is it the perfect scenario? Great range of motion, good muscle stiffness. That might be the perfect,
right. You got the best of both worlds. Yeah. Good muscle stiffness, but also good joint range of motion. Yeah. Best of both. Yeah. Because I know one of the things because my students ask this, I get this question probably every semester. When students in my classes ask, does stretching before injury or stretching before high intensity exercise or athletic competition, does it prevent injury? And I'm like, well, I said, the literature's murky, not sure. There's no, I wouldn't say conclusive evidence that it does or doesn't. But what I will say is you do need to be warmed up. You definitely do need to do a dynamic warm up before you participate in any, intense lifting, athletic competition. You need that intramuscular temperature to be elevated so that the muscle can produce force more effectively. You have adequate blood flow and oxygenation of the muscle, and it contracts with a faster velocity if it's warmed up. And it is for sure, a cold muscle just doesn't function properly, and you are going to be more likely to injure a cold muscle than a warm one. So you definitely need to warm up, right?
I would think a lot of the warm up probably includes the dynamic stretching component of it. I think a lot of times.
Yep. Well, kind of leads into the next. So we've talked about these different types of stretching. So when should you perform static stretching, dynamic stretching, and then I also threw PNF stretching in there. I mean, which ones of these should you perform before exercise, intense exercise or athletic events? Which one should you perform after? And then maybe why you recommend when you should perform these different types of stretching.
I'm going to say something a little different than maybe what you're expecting. It goes back to my point where we should consider flexibility its own component of fitness, which it is. It's written as its own component of fitness. We never treat it as that. We always treat it as this thing we do before something or after we do something.
Right.
You don't have to do before or after. You can stretch whenever you want. And we'll go into what the paper we're going to present. If you feel like you have to do the flexibility training, the stretching with a cardiovascular exercise or strength training exercise, I would probably do it after. And we're going to talk about why that would be, why we'd probably want to do it after. But I think that we should start thinking of it as its own component. I stretch in the morning when I go to bed. That's when I do it. I don't necessarily do it before or after. Now I warm up before I lift. I don't stretch then at that point. The caveat is, with the paper we're going to talk about, would suggest that, a good stretch prior to maybe a high intensity exercise probably shouldn't be there.
Right.
So if you feel like the need to stretch when you're lifting weights or doing cardio,
doing like a max squat or something,
do get your warm up in and do your squat. So I would put the actual flexibility training after the cardiovascular and strength training, or it can be completely done on its own.
Right.
So again, making a difference between stretching and warming up.
Right.
We always want to warm up.
Right.
But that doesn't necessarily mean you have to stretch then.
Right. Exactly. And you may notice, especially older adults, if you're trying to figure out when to add it in the day, you're probably going to be less flexible in the morning. So, now you just mentioned stretching in the morning. I'm like, you do that? I'm like, I feel better at night after I've hopefully moved around and walked around a bit, but more flexible at night, less in the morning.
Yeah. My gauge of my flexibility is like, can I put my sock on my foot standing there? Like,
Yeah,
if I can reach down and do that, it's like, I've got it today. I'm maintaining my range of motion.
And are you breathing heavy after you've done that?
Yeah.
So then there's two components maybe Dr. Herda needs to work on, his flexibility and his cardiovascular fitness.
Yes.
If it's tough to put the sock on and you're breathing heavy after it,
we're in trouble.
Oh, man. All right. Well, so let's get into this. You mentioned the studies. And I want to get into looking at your research. So let's look at some of this published research examining the acute effects of static versus dynamic stretching on muscle strength. So the first paper I want to discuss was published in 2008, so it's been a while. Forgive Trent if he can't remember everything that he did.
My very first project.
Yeah.
My very first study as a master's student.
And you can see there, I mean, this is where you were at University of Oklahoma here.
And my mentor, Dr. Kramer, was very interested in static stretching. I kind of mentioned, throw like a little dynamic. As a college athlete, it's like, I guess before practice, we would do some static stretching. Then we would do the dynamic warm-up, which there was more like a dynamic stretch. So it's where our interests kind of aligned and put this project together. And this paper is cited like all the time. It is by far one of the most popular things I've put out there. I like to think I've done a lot of great stuff here, but people alwa's come back to our.
Do you have any idea how many times it's been cited?
Probably over 400 sometimes.
400, yeah, that is. So
for me, it's pretty good.
So there's a lot of interest in the paper. That's good. A lot of interest in your work.
So I guess it's a short way of saying it. Everyone seems to be interested in the stretching stuff that we've done in the past.
Yeah. So the title of it, this was published in Journal of Strength and Conditioning Research, Acute Effects of Static versus Dynamic Stretching on Isometric Peak Torque, Electromyography, and Mechanomyography of the biceps femoris muscle, which is one of the hamstring muscles. So let's talk about what was the purpose of this study.
Yeah, like I said, my mentor at the time had started doing research on static stretching and the force deficits caused by static stretching. And that's where I kind of came in and proposed the ideas, what if we do a dynamic stretch? And I speculated that we might not see the force decrements following a dynamic stretch like you see with static stretching. And that was ultimately the focus. What I really liked about this project and something Dr. Kramer really wanted me to do, and at the time I didn't know a lot about the length-tension relationship, but we're stronger at certain muscle lengths or certain points of the range of motion.
Right.
And he thought, hey, let's look at and see if there's certain points in range of motion where maybe static stretching is more harmful or less harmful, or if dynamic stretching is better for you. And that's where this the knee joint angle stuff came in with this paper.
And if you're wondering, when Dr. Herda mentioned length tension relationship, we talk about this in our exercise science classes here at KU, but a muscle, if it's too shortened and too contracted, or it's too elongated, right? So I'm elongating my bicep, I'm making it as short as possible here in this concentric contraction. If it's too long or too short, it's not going to be able to produce as much force as if it's just slightly longer than its resting length. So there's this appropriate length that a muscle should be at to produce optimal force, but that's the length tension relationship. And so I guess just summarize, so your study, I'm just literally reading from the paper here. The purpose of the study was to examine the acute effects of static versus dynamic stretching, which we just differentiated between those two types, on peak torque, EMG activity, MMG amplitude, which is mechanomyography, of the biceps femoris muscle during maximal voluntary contractions of the leg flexors, which is the muscles on the back of the thigh, right, the hamstrings, at 4 different knee joint angles. And I'm sure you can maybe explain as we get into this what peak torque is and why you do EMG, and because folks probably going to have questions about that. So I guess this will lead into, is there anything you want to say with the purpose, or get into the methods, like the methods of this study?
Yeah, I think you covered it all there, and just let everyone know that the leg flexors is a great muscle group to do the length tension relationship, because we can really manipulate the length of the hamstrings, based on joints, so the knee and hip joints.
Okay, so that's why you were targeting that muscle.
You will see a lot in stretching research, leg flexors, and sometimes plantar flexors.
Right.
Plantar flexors are a little bit limited by the joint, like we discussed. Right. So that's one muscle group where the actual joint is a limiting factor in the range of motion.
So plantar flexors are your calf, gastroc and soleus.
So the leg flexors are usually why, because you can manipulate that length tension relationship, you can find you can really get it to the end range of motion where it's not dictated by the joint. That's why you often see it used in stretching literature.
Okay, that makes sense. That does make sense. So there's why the hamstring muscle group was targeted in this study. Okay, so let's get into the methods then. Maybe talk about the subjects, the different types of testing that was done in this study. So I guess maybe just start with the subjects.
Oh, good question. College age kids, I'm assuming.
So yeah, I'm trying to remember. Again, be easy on him. This was back in 2008, so it's been a while. Yeah. He's done a lot since then, right?
Yeah, I mean, even so, it looks like
healthy men.
Healthy men. So here's a little caveat to stretching literature. There are sex-related differences, and if you are trying to isolate a mechanism, a lot of time in the past, you just use males, but that's really gone away from that.
All around early to mid-20s, healthy men, early to mid-20s for the study. Yep.
So just a recreationally active population.
Right. And then if we get into the first type of assessment you did isometric strength testing for assessing peak torque of the hamstrings and biceps femoris. So maybe we pull up that second picture, and you'll see an image here. So this is the isometric strength testing setup for the assessment of peak torque. So maybe talk about, this is a dynamometer, what this is, what peak torque is, what you're doing here.
Yeah, so dynamometer is something you would classically see in most neuromuscular labs, also in physical therapy clinics. So it's a great way to isolate muscle actions at certain range of motions. And you can see with the hamstrings.
So here he's at like a knee joint angle, because you looked at 4 different knee joint angles. Yep. He's at about 101 degrees. Yep. I think that was one of the knee joint angles you looked at.
He'd be at 101 degrees, and that's a pretty long muscle length, a pretty large range of motion it's pretty close to end range of motion for the hamstrings. A lot of us would probably, quote unquote, feel a little stretch there.
Right. Right.
So we're producing torque, which is just the strength of the hamstrings, and how far his ankle is from the axis of rotation would be torque. So you have your moment arm.
Rotary force.
Yeah. Turning effect.
Right.
And that would be how we tested the strength of the leg flexors. So just a little caveat too here, even though he might not be actively contracting his hamstrings here, he's actually producing force because of tension on the muscle. Something that's oftentimes overlooked is at end range of motions, our muscles are actually creating a little force, but not actively. It's through passive.
It's just like if you stretch out a rubber band,
exactly.
Right? As that rubber band stretches out, you're getting more tension.
Exactly. So,
yeah. All right. Anything else you want to say about? Because I think I mentioned there was 4 different joint angles you measured peak torque at. So
I just went from long to short. I don't remember how we came up with those angles. This is probably from previous literature. This is it can be a standard measure,
right? So you looked at a knee joint angle of 101 degrees, which is what you see there, and then we start closing the knee, right? So, or flexing it, right? So you go down to 81, 61 degrees, and 41 degrees. So you measured peak torque at each one of those knee joint angles, right? So, obviously as you move from 101 here down to 81 and 61 and 41, that hamstring is going to be at shorter lengths when you're assessing that peak torque, right?
Yeah.
All right. Then let's talk about, we'll pull up picture 3. So there on the top row, remember we had 2 different groups. So we had a static and a dynamic group. So there where you see pictures A, B, and C, you're seeing static stretches. Some of those are partner assisted. Is that you there?
Yeah.
That is a young
he used to have hair
Dr. Herda. They're assisting with the static stretches in B and C. So again, those are just being held for whatever, I don't remember, 30 seconds each stretch.
Yeah, it probably lasted close to 10 minutes, I suppose. Maybe a little less. And you can see in the bottom row just the dynamic stretching routine.
So like some high kicks, some hinging at the hip joint, reaching over and touching the toes, and then F almost looks like a B skip or a not sure what you're doing there, but
probably was a B skip.
Yeah.
So you could quickly approach a dynamic warm up via dynamic stretching,
right?
If you're not careful. And I think also the static stretching, we're going to find out in the next paper, is really, partner assisted versus just the partner, and how static stretchings perform can really manipulate the results also.
Right. So yeah, it says for the static stretching, 4 repetitions of each stretching exercise was held for 30 seconds to the point of mild discomfort, but not pain. For the dynamic stretching, 4 sets of each stretching exercise. So the dynamic's the bottom row. Were performed by repeating the stretch continuously in a slow and controlled manner for 30 seconds, which resulted in 12 to 15 repetitions per set for those dynamic stretches. Okay. All right. So we had those, we got your baseline, dynamometer, peak torque testing, the strength testing. Subjects are split into a static stretching and a dynamic stretching group. All right. And then what are we moving on to next? The surface electromyography. So why did you do surface electromyography and look at that between these two groups?
Yeah, so surface EMG just measures electrical activity in the muscle. You need electrical activity in the muscle to contract the muscle, for the muscle to contract. So it's a kind of global, easy assessment of just overall muscle activation, how much of the muscle you're contracting in that moment of time.
So you're just placing electrodes over the biceps femoris, the hamstring muscle on the back of the thigh, and kind of look like the surface electrodes, like what you'd see like with a EKG for the heart.
Yep.
I mean, it's
similar principles.
Yeah. So just like EKG looks at electrical activity in the heart, EMG looks at muscle electrical activity.
And a very standard measurement in a lot of laboratories across disciplines.
Because did you think there was going to be a difference in electrical activity between the two groups, the static versus the dynamic stretching group?
Yeah, I mean, we thought if force was going to be reduced with static stretching, which we kind of thought what the hypothesis was, and we kind of knew what was going to happen. If it is induced because of neural factors, that would mean maybe muscle was less activated, so EMG would go down.
Right. If you had that reduced neural drive to the muscle, you may see less electrical activity in the muscle as a result of the static stretching. So then you would ultimately maybe get less force production.
Yes.
When you go back and measure peak torque again in that dynamometer that we showed.
Yeah, and then with the dynamic stretching, there had been some protocols or some papers that would suggest that it actually increases strength. Again, it kind of goes back to, was it dynamic stretching or was it a dynamic warm-up, which is kind of a murky gray area. Right. If it was a warm-up, you could definitely see how maybe you would end up with greater muscle activation.
Right, like a potentiation effect.
Yeah,
so that's where, by doing that dynamic warm-up, you kind of, you can think of it as it's easier to switch on the lights in the room or turn on those motor units and motor neurons and get that neural drive and that good, those action potentials being sent out to the muscle so that you can activate it and produce the necessary force for whatever activity you're getting ready to do. Yeah, that's interesting. And I think mechanomyography, I don't think we're going to talk about that much in the pictures. We may even skip over that one, but I don't know, maybe just briefly, what is mechanomyography?
Mechanomyography is, so EMG is the electrical output of muscle activation. Mechanomyography is the mechanical output. So it measures it's a accelerometer, it measures vibrations at the surface of the skin. It has a lot of, we use it in a lot of useful ways where it really associates strongly with fiber type. So individuals with larger muscle fibers tend to have more oscillations at the surface of the skin. So it's actually does pretty well predicting that fiber type of the VL. In the contents of this project, I'm not sure.
So maybe if you had a lot of type 2 fibers, like type 2 fast twitch that produce a lot of force, you'd have greater oscillations.
Yes. Yeah.
Compare that to somebody that's, maybe doesn't do much weight training. Maybe they're a cross-country runner and they have a lot of smaller type 1 fibers. They may not get as
exactly
oscillation.
And for this project, you can certainly come up with this path of like if it's less compliant tissue, it might have more oscillations.
Okay.
So that's where it really came in with the stretching literature research that we did.
Gotcha. Okay. Well, then let's get into kind of the since we talked about the methods and the procedures there. What were the results of the study? So let's pull up picture 4 here, and we're looking at peak torque. So graph A, you have peak torque. Again, this is measured in Newton meters. Oh gosh, we're going back to physics, right? So we're looking.
Don't forget about the moment arm. We need to know.
Right. Yeah. Rotary force, right? So then just think higher peak torque, more force, and A is static stretching, the static stretching group, and then you have the dark filled in circles is pre-stretching and post-stretching, and then in B, we're looking at peak torque for the dynamic stretching group, and then of course across the x-axis you have the 4 different joint angles you measured peak torque at prior to stretching, either statically or dynamically, and then after stretching statically or dynamically. So maybe talk about these graphs and what you're seeing here.
Yeah, the first thing to note is we're a little weaker at that long muscle length, and at the shorter muscle length we're a little bit weaker. In the middle,
at
of the range of motion,
at 101 degrees, you can see that the peak torque measurements are not as high.
Yeah, and even at the shorter muscle length, not quite as high. It's kind of in the middle there at 81 and 61 degrees.
That's what we're talking about, the length-tension relationship.
So you're
if a
seeing
muscle's too long or it's too short, it can't produce as much force as what you see there in the middle.
Yep. So that turned out how it should. We were glad to see that. And if, figure A is basically where the story is. At the longer muscle lengths, we saw a loss of strength in comparison to the shorter muscle lengths.
Right.
And with dynamic stretching, I don't know if this was a surprise.
And that's in the static stretching group. So at a knee joint angle of 101 degrees, if you compare the amount of torque they were able to produce before they did all that static stretching versus after, the static stretching reduced the amount of torque, peak torque, or force they could produce at that longer muscle length at 101 degrees, right?
Correct.
Yeah. But then you look at dynamic. The dynamic stretching group, the dotted line, the post-stretching measurements are pretty similar to the peak torque measurements before doing the dynamic stretching, which basically indicates there wasn't really a loss in peak torque or the ability to produce force with the hamstrings, the biceps femoris, by doing dynamic stretching. You didn't get a loss in that force production.
And I totally messed up. The 101 degrees is below full extension. So that's actually the short muscle length.
Okay, I was thinking.
When I spit out of my mouth, I was like, oh, wait. No,
well, when I looked at the dynamometer, so you're not going at knee joint angle. It looks like a knee joint angle of 101 because it's above 90.
Yeah, and when you said that, I guess I just resonated in my brain. But no, it's 101 degrees below full extension.
Okay,
so when I saw this graph, I was like, nope, I was wrong because I knew that it was the short muscle, the 101 degrees below extension, the short muscle length, where the strength was lost.
Okay, so at 101, so you can think of it as like if you're at 180, that's when you're extended, and then you flex 101 degrees.
Yep.
Yeah, you're going to be at a pretty acute joint angle there.
Yeah.
The knee's going to be it's really closed off, really flexed. But then on the other end of the spectrum, on the x-axis and the 41 degrees, so that means you went from 180 and then you've only flexed it like
yes, correct,
41 degrees. So that's actually the longer muscle length.
Yep.
So it's a longer muscle length at 41, a shorter muscle length at 100. 101.
And I just want to say again, it's been a long time since
I know. Hey, we're giving you leeway.
It dawned on me when I saw this graph. I was like, oh, we were wrong. We were backwards. Because I remember ultimately what the results were. I guess I forgot how we had measured the knee joint angle in this situation. So at the shorter muscle lengths, we saw a decrease in strength with static stretching. And there had actually been some literature that would show an increase in strength at longer muscle lengths with static stretching. We didn't see that for this project. But you can kind of see how the means would reflect what others maybe had saw. I mean, not to the extent that they saw. And then I think the dynamic stretching, we kind of thought there'd be an overall increase in strength, and we just simply didn't see it.
Right. And people might say, well, the dash line post-stretching for dynamic is just below the solid pre-stretching line, but it's not statistically significant. I mean, it's basically the same, even though it looks like it's a little bit reduced there for graph B. But yeah, I mean, just to summarize, so if you do static stretching, a bunch of that prior to activity, again, maybe it's a max effort, a 1 rep max in the gym, or maybe you're going to be sprinting, some max effort activity, it may reduce your ability to produce force at those shorter muscle lengths.
Yep, for the hamstrings and, maybe more different other lengths for other muscle groups. I think that it's important to know, we've done a bunch of follow-ups to this where, this acute loss in force doesn't last that long in the grand scheme of things.
Right.
It is a little bit associated with how long the duration of stretch. So the longer you stretch, the longer that force deficit is basically going to be there. But if this is, I think like, the football team stretching an hour before the game, there might be some force deficits occurring, but certainly it's not going to be at game time.
Right. Or not like if they stretch in the morning, right?
Yeah.
They're doing like a walkthrough or whatever. It's like, okay, you've got some morning activity, maybe do a little stretching, but the game's not till 7 p.m. that night. Yeah. It's not going to matter.
Where I think it can matter in sports performance is, what are you doing right before you get into the blocks in the 100-meter dash? Well, and you see people do like stretch the hamstrings and the calves. It's like, I, at this point, would not do that.
Would not do that right before they get in the blocks, right? Yeah. You want to be warmed up, but don't be sitting there holding a static stretch of the quads or hamstrings right before you get in the blocks, right?
So
it can impair your sprint performance.
Yeah, so you might think it's not applicable because, well, the force deficit is not going to last that long. But, I definitely certainly see in athletes where people are doing something like this immediately prior to.
Well, I got another example, too, and it just made me think of it. So back when I was playing arena football, and I remember because some of this was coming out even – this was, this study was 2008, but even early and mid-2000s, there was starting to be some stuff come out about this. And I remember when I was at a tryout with the arena football team in Wichita, and we were doing a combine, right? So you had vertical jump, you had the pro agility, short shuttle, 40-yard dash. And I remember the coaches were leading everybody through static stretching, and I wasn't doing any of it.
Yeah.
I mean, I was kind of, going through the motions, but I wasn't really stretching my muscle. Now I warmed up and I did all of our, our high knees, our butt kicks, our lunges, a karaoke, lateral lunges. I did all the warm up, but I was like, I'm not going to stretch, all these muscles out and maybe hinder my ability to produce force, and maybe impair my vertical jump output numbers or my standing broad jump or my 40-yard dash time. So I knew, and I remember even some of the athletes were kind of looking around like, he's not really doing this. And I had a reason for it. And I mean, part of that was, I was in an exercise science program then.
I always say, so I think I was someone particularly in college, was over stretching. Like too much static stretching, probably too close to my event. Where I think probably looking back on it, I maybe had some decrements because of stretching. But I always laugh. My fastest 60 or 55, I forget in indoor if it's 55 or 60, whatever it was. We were in the Eastern time zone. I had not reset my watch.
Oh, jeez.
So also, I'm looking at the hurdlers go. I'm like, I gotta go. So I go down. I did not do any static stretching. I basically just ran laps in the little warm up area.
Like, I'm up. Get down there.
So in that situation, I literally did just warm up. I did no stretching to the. I used to really stretch a lot prior to these events. It was by far the fastest time I ever had. Thinking back on it, it's like, well, yeah, it's probably because I was stretching my hamstrings like immediately before getting into the blocks. Was probably not the best thing to be doing.
Right. That's interesting. What was your fastest 100 time? This was at Sioux Falls, right?
Yeah, 100. I think
10.7,
10.6, something like that.
Yeah, that's good.
Not fast enough.
Not fast enough, right? Well, Trent didn't make it to the Olympics. That's why he's here at KU as a professor.
Yeah.
You need to get below 10. You got to be getting in the high 9s. Yeah. It was too much stretching. That's why. It was just too much stretching.
I'm blaming on the stretching.
You would have been hitting those sub 1000 meter times if you hadn't been stretching so much.
Well, it's another video that we need to do is just looking at these 100-meter times now, these high school kids, and just the training is so different. And we have, there'll be 50 kids in the state of Texas run 10.5s or below.
Yeah.
20 years ago, that's Olympic qualifying type time. So anyways.
Yeah. All right, well, we'll move on to the next figure. So we got picture, what are we on, 5? So EMG, so we talked about this in the methods. You're looking at the electrical activity of the muscle, and we're comparing what's the electrical activity before doing static stretching, and then post-static stretching. That's in A. And then in B, what's the electrical activity before doing dynamic stretching, and then after doing dynamic stretching. So again, the before stretching is the solid black circle, solid black line. The dashed line is your post stretching.
So if we look at figure A, this can be fairly complex. First of all, EMG amplitude is a fairly crude measure of muscle activation. We could probably better isolate this in future experiments, which we did actually. So if you look at A, so you see, well, muscle activation is pretty darn similar for the static stretching, even though they lost strength.
Right.
So in this moment, we would probably conclude that, well, it must be just the physical output of the fibers that were hindered and not the neural drive to the muscle, is one way you could interpret figure A. And it's plausible, it's believable. So the muscle became more compliant, even though they had the same neural drive. The force output just wasn't there on like a per fiber level.
Right. There's a little more slack in the system, trouble transmitting force to the bone, and so you get lower force output.
Yeah. Figure B is a little tougher to explain, where we have really pretty big jumps in EMG amplitude. This is probably...
you see it at the short muscle length, 101 degrees, and then kind of the mid 81. You see a significant...
So you're like, well, they didn't have any changes in strength. There's like a lot of ways you could look at this. One, not each way. I'm not sure what the correct way would be or what is the right answer. One could be, well, maybe the dynamic stretching was resulting in a little bit of force decrement, but the warm-up, maybe slight aspect of it, increased neural drive, so it kind of offset a little bit.
Right.
It could be something said, potentially there might have been, temperature changes that just changed how the signal was recorded. So it could be like we got greater EMG amplitude just because the skin was warmer.
Right.
So
okay.
There's
a lot of variables to consider as to why the dynamic stretching, altered that EMG amplitude, and you see it being higher.
Yeah, I mean, it's plausible that they did have greater neural drive, with as measured with the EMG amplitude in this case, but maybe the force transmission on the muscle level was lower, so it was a little bit of an offset. And then for the static stretching, it didn't look like muscle activation changed a lot, so it might suggest that it was primarily the force output or the force transmission of the fibers.
Okay. All right, let's move on to picture 6. I think actually on this one we may skip over. This was the EMG stuff. I mean, is there anything you want to say on that with the mechanomyography? So again, this is looking at the oscillations.
Yeah, this what makes me believe that there might have been some temperature. We're gonna have more oscillations with a little bit warmer muscle if you look at the dynamic, or both these could be saying that the muscle was less compliant. Certainly we can make that argument for the static stretching that it might have been less compliant, and so therefore we had greater vibrations at the surface of the skin.
Or wouldn't it be more compliant with static stretching? Like it's
excuse me. Yes, more compliant, more flexible.
Right.
Yeah, sorry.
More compliant.
Yep.
Like,
correct. How many times
I guess you would
that
say.
Backwards?
I'm trying to think of an example of something that's very compliant, like a very compliant tissue. Maybe like something that you can easily stretch out and it stays that way.
The less force it takes to stretch something, the more compliant it is.
Right. That's
I
a good
probably
way
said
of
that
putting
backwards
it.
3 times today.
Yeah, I think you said it backwards. So when you said less, I was like, doesn't he mean more? Yeah,
exactly what I meant.
More compliant, right. More compliant. So yeah, you think about it, just the static stretching, holding that stretch, elongating that tissue, makes it easier to elongate with subsequent stretches, right? It's easier to just elongate the tissue, right? So more static stretching, more compliant tissue, more, you think of just like Gumby, like it's just easy to lengthen it out. And then like we're seeing, because it's a more compliant tissue, reduce force output, which could impair performance. All right, let's go to the next question. So what conclusions did you draw from this research? What are the practical applications for athletes, strength and conditioning coaches, personal trainers, and folks in the general population that are involved in fitness, stretching, and strength training? So just bottom line conclusions and practical applications. And we can pull up picture 7 here. So kind of highlighted there. I kind of highlighted some of that bottom line stuff. And people can read through this. I mean, you don't have to read word for word this, but
I might even say something a little different than what we proposed, years ago. I think that you definitely do not want to provide a good static stretch to your leg flexors prior to an explosive movement or a high intensity bout of exercise. I definitely would probably avoid that. Immediately before.
After, if you're going to be doing that high intensity, that 1 rep max, that sprint, whatever it is that's going to require a lot of force output, you don't want to be doing the static stretching, 30 seconds or a minute before it.
If you're in a situation where you're getting tested on vertical jump, stuff like that, I definitely would not recommend doing that. But we don't get into too much here, but it is important to do it to improve range of motion, just not prior to that bout of activity.
Right. He's not saying don't stretch ever.
No, not saying
just that. Be very specific about when you stretch, right? All right. So the next paper of yours to discuss was published in 2011 in the journal Medicine and Science in Sports and Exercise. So the title of this paper, we can pull up picture 8 here, is Effects of Two Modes of Static Stretching on Muscle Strength and Stiffness. So let's talk about what was the purpose of this study.
So this was my thesis as a graduate student, so maybe the second or third project I had conducted. And this is where we started kind of realizing conflicting evidence in the literature whether static stretching reduced muscle stiffness or not. And something that kind of caught my eye was the fact that there are actually multiple forms of static stretching. One being, you go touch your toes and you stay there.
Right. That's an active static stretch.
Yeah. And one where you kind of have someone assisting in the stretch and continuing to put constant pressure on you.
Right.
Or
which is
maybe
passive.
Yeah. Or, you take slack out of the system, keep
right.
reaching
Here, stretch my calf. It's feeling tight. Do a passive stretch on it. Just go ahead and push that back. Yeah. Okay. Passive,
yeah.
Right.
I stretch your hamstrings.
Right. That was my hamstring.
Yeah.
I was wanting calf. It's all tight. I'm getting old. I need to stretch. I don't do enough of it. So.
So we I think designed a pretty clever experiment here to really outline, like, even though we say static stretching and no one really knows that there's multiple forms of it, but really the type of stretch can really influence changes in stiffness and in the passive resistance of the muscle.
Right.
And not so much range of motion.
And so that's important to keep in mind when we talk about this study is there's, I guess you referred to it as constant angle stretching.
Yes.
Which is where it's an active stretch. Like, okay, so I'm going to stretch my tricep and my lat. So I bring my arm overhead.
And you hold it there.
And I've reached this angle. And I'm just going to maintain that angle, a constant angle. Or I bend over and touch my toes and I'm maintaining that angle. Versus the constant torque, here's where you're having a constant amount of pressure.
Yep.
Applied to whatever muscle that you're stretching.
Yep.
Okay. Which is a passive stretch. Like would it be considered passive?
I think operational definitions is whatever you say it is.
Right.
There's
semantics.
Yes. We would probably consider both these passive in the sense that you're not activating your muscle.
Right. Okay.
Like PNF, we would maybe call it like an active stretch because you are activating your muscle.
Right.
So the passive in the sense the muscle's not being activated, but we're doing two forms of static stretching. One where we just hold it at constant length, and then one where we have a constant pressure placed on the tissue.
Okay. So we're kind of getting into the methods already. So what were the subjects in this study? It looks like 17 healthy men.
Yeah, I would say best regularly active. Maybe no serious lifters or aerobic athletes per se.
No neuromuscular disease. They're all healthy. They're young, college age, 21, 22 years of age. All right. And then
I think one important part to understand is, so how did we do this constant torque or constant pressure? We used a dynamometer for that. So we can actually set that dynamometer to run through a range of motion. Yeah. And then we can either stop it to hold it at a constant joint angle, or rather than stop it, we can put the amount of force we want it to like the strength of the dynamometer, we put at 20 pounds. It's going to stop once it feels resistance of the 20 pounds versus that platform.
Right. So because you're again looking at the hamstrings, biceps femoris. So once it hits that 20-pound mark, it's going to stay right there. Yeah. That constant pressure.
Yeah. And I think this is actually the plantar flexors in this one. I think.
Leg flexors.
Oh, there we go.
Yep.
No, leg flexors. You're right.
Yep. So hamstrings.
I need to read my stuff more often.
It's okay. Well, the thing is, Dr. Herda produces so much research, hundreds and hundreds of articles.
No.
He cannot keep track of what he does.
Well,
it's okay.
I play college football too. Some headshots.
Right.
So 10 years.
Me too. I'm telling you that we're both going to be drooling on ourselves, and we're not even going to recognize our own image in the mirror here in like 10 or 15 years.
Yeah, I'm trying to think. I think
too much football.
I think it must have been Dr. Eric Ryan. I think he might have been the one working with the plantar flexors more at the time, and I might have been doing the leg flexors, regardless.
Right. And back when we played, you could actually hit each other in the head.
Yes.
That's what was bad about it, I guess.
you just stood up and walked back.
Right. I can't see anything, but I'll smell the huddle. All right. So, oh, never forget the smell of the football locker room. That's I'm going off on a total tangent here. So let's talk more about. So again, just like in the previous study, you were using this dynamometer to strength test and measure strength, and then using it for the constant torque or the pressure to the hamstrings. What other methods did you use here?
So something else was a little different. We measured stiffness, the properties of the muscle at 3 different joint angles. So, the last project we measured strength at 4 different joint angles, basically.
Right.
So this isn't, active strength. This is the passive strength that we measured at a couple points in their curve as their leg was being extended. So their leg would be extended, held, extended, and then would maybe move a little bit with constant pressure, but we would measure
basically
stiffness.
How much passive resistance there was, stiffness, right?
Yep.
How much resistance there was to stretch.
Yeah. So this assessment was acquired during the actual passive stretching movement.
Right. Okay. All right. So let's move on. Talk about the results of the study. So we pull up picture 9. So here we have, it looks like on the left, so this is your constant angle where the knee would have been maintained at different joint angles and the hamstring would have been under this constant angle stretch.
Yep.
And then on the y-axis, you're looking at musculotendinous stiffness. Of course, the x-axis is the different joint angles. And then on the graph on the right, you're looking at the constant torque. So this is where that constant pressure was being applied by the dynamometer.
Yes.
And you're looking at, again, your values, your musculotendinous stiffness prior to and post that constant torque stretching.
This is a fairly complex figure to understand in the sense that, the muscle tendon stiffness measure is the really the slope of that passive stiffness curve. So, as their leg was moving up, their stiffness curve, their strength, their passive resistance of their muscle would be non-existent, and then slowly increase rapidly.
Right. So as the hamstring muscle length increased, initially it's not much, but then it's like exponential.
Yep.
The passive resistance is going up as that hamstring is elongating.
Yeah. So essentially, what this figure is showing you is that the slope was lower, so it didn't raise as rapidly with the constant torque. So the curve kind of, for lack of a better term, kind of flattened out a little bit.
Okay.
So it kind of flattened out a little bit. The rise in that passive resistance produced by the muscle wasn't near as rapid prior to the constant torque stretching.
Okay.
And then the constant angle, that curve remained the same. Nothing changed in that curve.
Right.
The shape of the curve.
Yeah, the pre and the post, those lines almost overlap.
Yep. So really this is almost like a measurement of the shape of that curve. And on the right, the constant torque kind of dulled that shape or kind of muted it a little bit. It didn't rise as quickly.
Right. So I guess the take-home message, bottom line, to make it simple for folks, is like the constant torque where you're applying that constant pressure. Like if you had a partner helping you stretch, right? A partner applying that constant pressure to the hamstring or maybe the calf, you're pushing on the ball of their foot, pushing the top of that foot towards the shin, stretching out the calf. I mean, that's like a constant torque.
Yep.
And you see that after doing that is reducing, based on this graph, the musculotendinous stiffness.
Yep, the stiffness of the muscle. Yeah.
Right. Okay.
And this is, and we'll probably go to the next figure here.
Yeah, we'll pull up picture 10. So this is just this is just showing your mean, so your averages and standard error values for before and after stretching for several different variables here: maximal voluntary contraction, peak torque, EMG, and passive range of motion. So maybe talk about this.
Yeah, I think the important one to capture here is range of motion change in the same manner across both stretching techniques.
Yeah, so CA is your constant angle, right?
Yep.
And then constant torque, that's where you're applying the pressure to the muscle. And passive range of motion there, PROM.
Yeah. So I think remember that when we go to this, I think we'll probably go to that this next figure, is range of motion stayed the same. So regardless of the stretching technique, changing the stiffness of the muscle in one instance, it didn't change the stiffness of the muscle in the other instance. Right. But range of motion still changed the same across.
Yeah, because on the previous picture that we showed, the constant torque stretching reduced the musculotendinous stiffness. But although that happened, if you look at range of motion between both forms of stretching, the constant angle, just holding the stretch versus the constant torque, no difference.
Yeah. So, I think one of the takeaways of all this is subtle differences in the way you stretch. The response to the muscle is likely going to be different. But the difference in response is not necessarily range of motion or flexibility.
Right. And we can pull up the next figure. Next picture. Oh, this one's kind of hard to see, but
we'll go if you go to because this is just showing the data from the figures. So if you would go find the passive torque figure, so you probably have it in here.
Yeah, we'll go one more. Next one.
There we go.
There we go.
So this table just reflects this figure and then that previous stiffness figure. So here, you're like, well, what the heck's going on? We see a decrease in passive torque in both situations. This is not active. This is passive. So this curve, no resistance, a lot of resistance, a lot of resistance. For each instance, there was less resistance at each angle. So the shape of the curve did not change for the constant angle stretching, but the curve went down. So basically how they read into this measurement is the sarcomeres had less resistance when they were being elongated.
Okay.
So constant angle and constant torque stretching was manipulating the resistance of the fibers sliding past each other, but constant torque was also manipulating the other non-contractile properties in that tissue that caused the curve to lose its shape.
All right. So when he talks about non-contractile components of the tissue, these are other proteins. You've got in there, desmin, nebulin, titin, dystrophin. You've got all these non-contractile proteins, so they were altered. And if you're wondering what a sarcomere is, if you look at a muscle fiber in series, like links in a chain, you have a sarcomere, all the way down the length of fiber. And within the sarcomeres, you have these actin and myosin filaments that kind of can bond together. And they literally form cross bridges and connect to each other. Like if you're going to produce a muscle contraction, they connect the actin and myosin filaments, and they shorten each sarcomere all the way down the length of the fiber, which shortens the whole fiber. But I guess just to go back into what you said, how did these different types of stretching affect those bonds between the actin and myosin filaments? That's what you're getting at.
So. Yeah, in the literature was really back and forth on whether static stretching changed stiffness. And when you dug into it, you realize, they weren't really understanding the subtleness difference between the stretches they were incorporating in their experiments or in their studies.
Yeah.
And we kind of thought, so you know what? The reason why it's so conflicting is they're not really recognizing a static stretch held with a constant pressure versus a constant muscle length is two different things.
Right.
And that's basically where we went with this paper and just outlined, one, hey, range of motion is probably more of a stretch tolerance thing and not really associated with the changes of the tissue. And two, changes of the tissue really is dependent on the load you're placing on that tissue. And when you just say you're static stretching, it doesn't necessarily mean there can be subtleties in that load being placed on your tissue based on how you're doing that static stretching.
Well, it's just like if you think of an eccentric contraction where you're under load, like you're doing a bench press and lowering a load, you're undergoing a stretch there in your pecs.
Correct.
I mean, and it's kind of pulling those actin and myosin proteins apart. I mean, you're having an effect on those contractile proteins that are part of the contractile component of your muscle tissue, the sarcomere. But and then you mentioned the non-contractile components. So I mentioned some non-contractile proteins, but what about the fascia, like the epimysium and the perimysium and the endomysium, all these it's like connective tissue wrapping around the muscle fibers and the muscle itself.
When it's done in a passive manner like this, where we're just slowly moving that limb, it's thought of, and I think other labs would support this with their data, that it doesn't really measure the properties of those tissues.
Okay.
In how we performed this this study. So not saying that it's not a factor. We can't say that it wasn't a factor, But when you're doing it in the type of manner that we are, it seems to be, or most people say, it's less of a factor in our measurements.
Right. I gotcha. I think that is all well, there's one more, the conclusion. So what conclusions, is there anything else you wanted to say about this one?
Yeah, I think we covered it. It was really just kind of digging into why there's such conflicting results in the stretching literature. And in this paper, my thesis was really just outlines like, hey, dummies, you're placing two different loads on the tissue. You're not understanding that.
Right.
One load's going to cause something to happen to that tissue versus the other load.
Right.
Then also, we were not new to this game, saying that I think at this point everyone was pretty well aware that end range of motion wasn't necessarily so much associated with that load, and is probably more associated with pain tolerance in these type of experiments.
Yeah. Okay. Well, then we'll go on to the last question here. So what conclusions did you draw from this research, and what are, again, the practical applications for people engaging in a stretching routine, or practitioners, maybe somebody working in a clinic, a PT, where they stretch patients, for example, or anyone that's working with clients or athletes, like I said, a trainer.
Yeah, I think...
and we can pull up picture 13 too.
Make sure to use the terms correctly. If you're having a constant pressure put on a muscle, it is going to be less stiff and more compliant acutely after versus a constant angle stretch.
Right.
So we're just holding the same length.
So this could be beneficial, somebody that, they've had a neurological issue, a stroke, whatever. They have some, I can see how the constant torque, the constant pressure stretching may be more beneficial in certain clinical populations for improving flexibility and reducing musculotendinous stiffness.
Yeah. Certainly, there's definitely in aging clinical populations where muscle stiffness is maybe a factor,
right?
And so you would want that constant pressure on the stretch. I think, again, I'm not in this literature so much anymore, like it was 10 years, 15 years ago. I think they've also shown that constant pressure stretching for durations of time in the training program would be more conducive to increase the compliance of the muscle, if that's what the goal would be.
Yeah. And so I'll just summarize it. Like it says, in summary, you might be wondering what some of these abbreviations are, but I'll go through it for you. So in summary, passive torque and passive range of motion changed in a similar manner for both treatments, meaning if we examine the constant angle versus the constant torque or the pressure being applied to the stretch. However, musculotendinous stiffness, that's the MTS, decreased after constant torque, that's where the pressure was applied to the stretch, but not after just holding a constant angle, like a normal stretch, static stretch. If the primary goal of the stretching routine is to decrease musculotendinous stiffness, these results suggest that a static stretch held with a constant pressure, which is that constant torque stretching, maybe having a partner apply that pressure, or you could use something like a band too to pull, right? I could, like I said, I had my foot up here earlier, and if I wanted to stretch my gastroc, my calf, my plantar flexors, I could put a band around and apply some pressure to help get that pressure on the calf. And that type of stretching would be more appropriate then for the decreasing musculotendinous stiffness than the constant angle stretching. And then I think what's interesting too is it says, in your summary that you have written here, that practitioners should be aware that despite greater changes in musculotendinous stiffness after the constant torque stretching, after applying that pressure, there still is not a greater reduction in strength compared with the constant angle stretching. So it's not, because people may wonder about that.
Yeah. So we had, so strength, the decrements were there for both, but the changes in tissues differed, and the changes in flexibility were the same. So there's all these caveats with stretching, and this paper really helped, I think, the field just better understand how stiffness can change more so for one stretch versus another, but not maybe affect strength or range of motion to
a significant degree.
Yeah.
How can people contact you if they have questions about your research, the Neuromechanics Lab, or the Hawk Fitness Academy?
The easiest way is through email right now, t.herda@ku.edu. Hawk Fitness Academy will be back this summer. During COVID, it had stopped. And it will actually be housed under a center, the STEM Fit Center at the University of Kansas. So all that's coming up for us. But for now, just shoot me an email and we can get you involved.
Still have a Facebook page for Hawk Fitness Academy?
Yes, it's not managed
Okay.
Closely.
Okay, well.
Like I said, the Hawk Fitness Academy, dormant for a little time. We're bringing it back better than ever this coming summer.
2024.
Yeah, this coming summer. So if you are interested in youth and physical activity and exercise, please contact me. Just send my email address. But maybe a year from now, you'll be able to Google it and it'll come right back up for you.
And that goes for any questions about stretching or the Neuromechanics Lab as well.
Lots of stretching questions in my inbox.
t.herda@ku.edu, right?
Got it.
All right. Well, thank you for being a guest on the show today, Dr. Herda. If you have questions for me about the KU Exercise Science program, send an email to jtaylor@ku.edu or call 913-897-8516. Thanks again for watching another episode of Fitness Facts.